Hi, good afternoon, Acrisure Agency partners. Hope you are all staying well and enjoying what is left of the summer. My name is Brad Yerhausen. I work alongside Bob Kroom on the National Employee Benefits practice. Bob and I are very excited to welcome you all to episode 2 of our 5-part PinPoint Plans webcast series. For those of you who are new to this series, welcome. You're joining at a great time. For those returning agency partners, welcome back. We're very excited to jump in today's topic, which is it's all about being self-funded. Before we do, just a few quick housekeeping items. As always, just to keep background noise to a minimum, we do have all the participants in listen-only mode. That does not mean we don't want your questions. In fact, it's the exact opposite of that. This is intended to be a dialogue with all of you. So please use the Q&A box that you have in your control panel to submit questions throughout the call. We will be monitoring those and responding to those accordingly. We also do have a section dedicated at the end of the presentation to respond to all those questions. So keep them coming. Secondly, we are recording this as we always do. All of you will receive an email once we conclude, probably sometime tomorrow, with a link to a landing page as well as to a link that contains the recording and a copy of this slide deck. So you've got all sorts of different ways to refer back to this material. So that covers housekeeping. So as I mentioned, this is episode 2 of 5 of the advisor audience track, which is specific to Acrisure Agency partners. So all of the participants on today's call are your peers, Acrisure Agency partner consultants, account executives, account managers. And we put this series together for you. You can see we've got a series of episodes that will be coming, and Jeremy Price, who I'll introduce in just a second, will cover the remainder of the year later on as we go through the slide deck today. But really, we did this for 2 reasons. One, we wanted this to be educational in nature. So we wanted to give you and your clients an opportunity to learn about what else is out there in the marketplace. And we wanted this to be growth inducing for your practice. We wanted to give you a turnkey solution to going out and having this conversation with your prospects so that you can grow your practice. So every episode we do a version like this where it's facing the advisor network, and then 2 weeks later we do virtually the same webcast for employers. So we change the terminology and the messaging a little bit, and we do that so that we can give you something that you can bring your clients and prospects to drive organic growth into your practice. So before I turn it over to Jeremy Price to get things started, just wanted to kind of set the stage with a few more quick comments. So for those of you I haven't had the opportunity to meet yet, you may not know that before I joined Bob Kroom's team last year on the National Employee Benefits practice, I was the practice leader for an Acrisure Agency partner in the Chicago area called Presidio. And in fact, my colleague, Blake Erickson from Presidio, spoke. He was a guest speaker on episode 1 a few weeks ago, and Blake spoke about his experience putting one of our groups into the PinPoint Plans program last year and how well that's going. And Blake made a comment that is so true. And he said he gave me a lot of heartburn when he joined the practice because he was constantly kicking the tires on these different self-funding strategies. And it's true. And I will say this with pride, you know, I didn't know what I didn't know in the marketplace. Our practice looked a lot like many of yours probably do today, a lot of small and mid-sized employer groups, a lot of fully insured business. And it just was uncharted water. And I was maybe a little embarrassed to admit I didn't know what I didn't know. And it took, you know, his leadership and our other team members at Presidio's leadership to pull me into some new places, which have been very, very prosperous and very healthy for our practice. So I say that to all of you because I wish that I had had the opportunity to join a call like this 3 years ago, because I think locally we could be even farther down the path than we already are in this alternative self-funded world. But thanks to Blake and thanks to so many of you out in the network that are out there exploring new strategies, being innovative, and kind of challenging the status quo, you know, at least we're on this path and we're moving forward and we're using it for growth. So I would encourage all of you to keep an open mind and ask questions. Again, this is intended to be a conversation with all of you. Please submit those questions throughout the call, and we will do our best to respond to those and get you going on your way. So with that, I will turn it over to Jeremy Price.
Thanks, Brad. As you go through the meeting today, we really, as Brad said, hope that you'll send in some questions. This is an opportunity to learn and have a dialogue, and there's really no unintelligent question as we go through this. So who you're going to hear from today, we're going to talk about, I'm going to later in the presentation talk through PinPoint plans and how we leverage a self-funding platform. First, you're going to hear from Seth and how he leads his clients through self-funding conversations, and then Chris Hillier, understanding stop loss, how to explain stop loss, some of the high points associated with that. Very exciting dialogue today, and take a lot of notes because there's going to be some great best practices that we go through. As with anything, there's a couple of key takeaways that we want to make sure we get out of any meeting, and we hope that these are the 4 points that you come away with some better understanding. First and foremost is everybody, insurance is a funding mechanism, and everybody's self-funded to one degree or another. If we have high claims in a fully insured group this year, we're going to pay for it in rate increases next year. And so whether you know it or not, you're already self-funded. 2, we are in a very unique time where it is critical to start having a different conversation with our prospects and clients. If we're not willing to have a conversation around self-funding or different strategies, somebody else is going to come in and have those conversations. 3, the opportunity is ripe for companies to take advantage of blending self-funded strategies and cost containment tools to generate liquidity, savings, cash flow, and there's almost not a CFO in the country in today's environment that's not looking for a mechanism to save some money. And 4th, and maybe even most important, as you come away today, if you're not an expert in self-funding, that's okay. We're here to help. It's truly not rocket science. We're here to give you great language and tools to take these conversations into your prospects and clients. As we look at the EB practice here at Acrisure, PinPoint Plans is designed for you. The vast majority of our clients are small groups, and PinPoint Plans is designed specifically with that in mind, with the ability to bring a turnkey, sophisticated, self-funding solution down market for small groups. We've got creative self-funding solutions, a great prescription program, and a proprietary stop-loss solution that if you've got a client, really, truly, they ought to be taking a look at this. And, you know, we can go down as far as 20 lives. So, sophisticated solution for small groups. So first up, we've got Seth Denson. If you've heard Seth speak, Seth is a very dynamic thought leader in the healthcare space. He's a nationally sought-after speaker, a regular contributor to news outlets across the country, an author, and we're just tickled pink that he'd join us today and walk us through the conversations that he's having. Seth, welcome.
Jeremy, thanks, buddy. And man, it's great to be with everybody today. And I'm excited to spend the next 3 hours talking about self-fund. I'm kidding. The problem with video calls that aren't using video is that you can't see my really bad facial expressions, which are trying to convey my jokes, which are bad to begin with. Nonetheless, hopefully I'll spend the next, we'll call it 10 to 15 minutes kind of walking you through what I would consider to be just kind of a foundational conversation around self-funding. And I'm thrilled to see the steps that Acrisure is taking alongside, Breakpoint and 44 North and the others to really bring this turnkey solution to us. And one of the things that hopefully you realize at the beginning of this, and this is ours. This is nobody else's. And isn't that something that, man, every broker wants in the industry, is to have something that nobody else has. And that's what this is. And the beauty of it is, and while this is going to be a great solution for so many of our clients, it is always a great solution to have a discussion, whether it's the best solution for that client in the end or not. And so if you're not using this as a way to engage in a conversation, then you're not doing yourselves any favor, and you're not utilizing all of the resources that Acrisure is giving you. Because this is certainly something that warrants a conversation when you're reaching out to a prospective client and saying, hey, I want to share with you something that we have created that you can only get through us, that is yielding significant results in better managing cash flow and improving employee experience when utilizing the healthcare system. Can I have a few minutes of your time? And if they say no, punt, move on. Somebody else will say yes. And this is a great thing that you know that nobody behind you is going to be able to have this message to deliver. And so I want to encourage you that way, first and foremost. Secondly, if for those of you that were at Producer Summit and got to hear the brilliance of Chris Hillier, who's going to speak in a minute, you know that he and I and a couple others talked about kind of messaging around the healthcare space today. And Jeremy mentioned it at the very beginning, but I'm going to mention it again. As we're starting to think through having a conversation with your client, I want to encourage all of you to do whatever you need to do to find confidence in your messaging. Because and how we do that is through knowledge. It's what you're doing today. It's being on this call to learn more about this. But what I love how this has been built is, as Jeremy mentioned, it's turnkey. There is a lot of confusion around self-funding, and in our industry, we are stuck in this world of shiny object syndrome where everything is a silver bullet. Guess what? Nothing is a silver bullet. There's no such thing, not in healthcare anyway. And so recognizing that from the beginning allows us to have a more consultative conversation with our client to determine what is, quote unquote, the silver bullets, not the silver bullet. But you need knowledge so that you can be confident, because knowledge breeds confidence, that breeds enthusiasm, and enthusiasm sells. And so this is something we can all be knowledgeable about so that we can be confident about it, so we can bring enthusiasm and win more business. And so what I hope to do over the next now 7 minutes is going to be sharing with you just kind of some simple talk tracks to think about as you're building your knowledge and your confidence so you can have this conversation. And just to kind of give you some background. 6 years ago, 80% of my portfolio was fully insured. 6 years ago. Today, which is the same it's been for the last 4 years now, I guess, 95% of my business is self-funded. And so as I think about my portfolio, and by the way, my portfolio ranges in size from 2 employers or 2 employees up to about 5,000, with the vast majority of my clients in that 50 to 500 space range. And so where I'm going with this is that there is sometimes a connotation around self-funding that it's risky, it's dangerous, leaves me exposed. And my message to that is the same thing that was said at the very beginning. Everybody's self-funded. Every employer in America is self-funded. And if you don't believe me, pull up CNBC today and look at United Health Group's stock price. It's $300 a share. It was $27 a share on the day the Affordable Care Act was passed. That's 1,000% growth since March 23rd of 2010. And so this idea that the insurance company is going to sell me something that they're willing to lose money on is ludicrous. Everybody's self-funding. Everybody is self-funded. And so let's get past this, what it's called. And here's the reality. Self-funded is not self-insured. And I think that's a confusing conversation that a lot of people think, oh, I'm self-insured. No, you're not. You're self-funded. It means you're funding a portion of your claims. You're not self-insured. Even self-funded plans have insurance. They have protections. They just give you the benefit on the back end. Because when it comes to fully insured, we often refer to that as heads they win, tails you lose. If you cost the insurance company more money than they collected from you, guess what? they're going to want it back. And if you don't cost them more than they gave you, they ain't giving it back. You are constantly utilizing your dollars to impact their bottom line. And so as you're talking to your employers, start with the basic conversation of self-funding is not self-insured. That's a different conversation. And everybody is self-funding. And so once we understand that, then we can start to break down what makes companies successful versus unsuccessful. Because I assure you, a cancer claim is a cancer claim. And so as we think about kind of the overall process, Brad, you can go ahead and advance the slide. There is really one way to reduce cost. One way. You reduce the number of units of claims you're consuming or the price of the claims that you consumed. That's it. Dumber underwriters aren't in existence. Insurance companies willing to take losses? Not there. Sadly, though, when it comes to insurance companies and underwriters at insurance companies, I can say this because I used to be one, they're playing a game of chess while we're sitting around playing a game of checkers. We're thinking one move at a time. They're thinking 5 years ahead. And so as you think and are talking to a prospective client or a client and you're asking them that they plan to be in business for 5 years or even 10 years, then do they really think that they won't be providing health care to their employees in the next 5 to 10 years? Assuming we don't have a change in administration and Medicare for all becomes a thing, and at that point we're having a very different conversation anyway. But if you're planning to be in business for 10 years, you will be providing health insurance for 10 years. So why are you playing checkers while the industry you're paying to manage your health care is playing chess? They're beating you because you're not even playing the right game. So let's start with the premise that the only way to really reduce cost is to reduce the number of claims that your people are consuming or the price of those claims. And that's what PinPoint allows us to do. It allows us to understand claims that shouldn't be paid to be managed better. And then secondarily, those that do need to be paid to be priced better on a basis that is very competitive in the market. Because a cancer claim is a cancer claim. Would you rather pay $80,000 for the cancer claim or $120,000 cancer claim? That's not a trick question. And so that's the beauty of this. And the reason that self-funded has failed in the past is because, quite frankly, brokers suck at selling it. And they are even worse at managing it. Because when it comes to effectively self-funding, hope is not an effective strategy. Most companies self-fund and say, boy, I hope we don't have bad claims. Guess what? You're going to at some point. And when you have those bad claims, do you really think that the fully insured United Healthcare is going to give you the benefit of the doubt? No, they're not. So why not, when you have those bad claims, make sure you have a plan that makes sure that you're not wasting dollars on unnecessary claims or spending higher prices on the necessary claims. And the PinPoint plan allows you to do that. So as we think about what PinPoint can allow us to do and self-funding allow us to do, it can allow us to accomplish what we oftentimes in the industry call the unicorn. Brad, go ahead. Better benefits at lower cost. Because if you survey 100 CEOs and CFOs and HR managers, and you break down all the minutia of the things that they tell you that they really want, you will come to this conclusion. They want better benefits at lower cost. And historically, we've always said that this is the unicorn. This is the ungettable get. We all laugh it off. But the reality is, it can be a gettable get. In my own portfolio, I'll tell you that the average client that I've been managing for 5 years or more is paying less today than they were 5 years ago. I'll say that again. My average client today is spending less today than they were 5 years ago, all the while improving the quality of their benefits, lowering deductibles, making care more accessible, doing what I call bringing the milk to the front of the grocery store. There's an analogy that why do grocery stores put milk in the back of the grocery store? Because there's no profit in it. Well, healthcare is generated in the United States, the vast majority of it anyway, by 6% of our population. And what has generated the profits that I was talking about earlier for the health insurance companies and the healthcare industry is that we have made healthcare less accessible. We've put it as the milk in the back of the grocery store. High deductible health plans have done that. We've asked our employees to pay more, either in premiums or pay more before they can get access to care. This means that they're not getting the care they need. when they need it. Stage 1 cancer is a lot cheaper than stage 4. Diabetes that is treated and managed is a lot cheaper than that which is not. A physical therapy to replace for a knee injury is a lot cheaper than a knee replacement. So we need to get to the point where we're bringing milk to the front of the grocery store. We need to make care easier to access, not harder. And PinPoint Plan does that. Because when we do that, we are simultaneously creating better benefits at lower cost. So to understand that component, we have to understand where our supply chain is. That health care is not health insurance. Health care is what we get. Health insurance is how we pay for it. There are 4 components to the healthcare supply chain. There are inpatient services, outpatient services, prescription drugs, and doctors. All healthcare is in one of these 4 buckets. So when you're talking to your prospective clients, ask them how and who is managing their healthcare supply chain. Because if they're telling you it's Blue Cross, United Healthcare, Cigna, or Aetna, then they're not managing their supply chain for their benefit. They're managing it for their own. And we can see that in the lack of data that is provided as a result of that. So in the PNC world, we talk about this all the time, right? If you went to a client and you said, hey, your mod factor is going up to a 1.2, that client's going to want to understand the loss ratios. They're going to put safety committees in place. They're going to do everything they can. But when it comes to healthcare, we don't. We're scared to ask for data, or we're in a platform that doesn't provide it. So if you want to better manage supply chain, you have to have data. You have to know where your supply chain is getting utilized. PinPoint Plans allows you to do that. So it's a great question and conversation to have with a prospective client. Where are you getting data? And how are you managing that data? Because data only derived with the past is akin being an informed idiot. It does you no good. But if you have the right data, then you can develop a strategy. Because data allows you to understand how and who your company is. So in the same way that you manage your workers' compensation and develop a strategy around it, you can do that in healthcare, and it can yield you a better result. Because once you have the data and develop the strategy, then you can pick the right tools that are out there, those shiny objects we talk about, that we have built into PinPoint Plans that can help you execute on that. So from data to strategy, you get tools to utilize. And the beauty of what we've done with PinPoint, or what Breakpoint and their Acrisure team has done with PinPoint, is they put these tools together to where you don't have to go out and find them all on your own. And we're constantly working to improve this because, as I've said a lot of times, success isn't a product, it's a process. And this plays a key role in that process, because once you have the data and the strategy and pick the tools, then you execute. You literally execute. And the reason there's arrows on this screen is because it is a constant engagement. This is not a once-a-year conversation. This is a constant level of engagement. What does constant engagement with your client through data, strategy, tools, and execution do? It provides you with the ability to protect yourself from the competition, because they can't get what you're giving them anywhere else. They can't BOR this away from you. It's yours, it's ours, and it's powerful. And so I want to encourage all of you that are on this episode, as you're thinking through this, I'm happy to work with any of you and help guide you through these conversations. We're all in this together. We all want to grow a better organization and improve our own portfolios. This is working. I'm proof of that. And certainly you can be as well. And nobody can say it better than your next speaker. But in the meantime, I'll turn it back over to Jeremy. Thanks for letting me be part of this, man.
Hey, Chris, thanks so much. That's phenomenal. Chris, if you don't mind, sorry, Seth. Let me ask you a quick question, Seth. As you go in to meet with a new prospect and you bring this messaging in, how many times have they heard this message before you get in and have that conversation with them?
They haven't. They haven't, at least not in this way. I mean, there are certainly, and let's be very clear, there are certainly people out there having conversations about self-funding. And there's certainly people that are utilizing some of the terms and terminology that we've talked about today, or that I've talked about, or that you've talked about, or that Chris will talk about. But nobody is putting it together in a way that they can back it up with an executable process. And that's what I'll encourage all of you to understand, that right now in our industry, we are in this, and I've heard Bob say this, in this world where we have a lot of talkers and not a lot of walkers. There's a lot of people out there that can talk, but they can't walk the walk. And what I love, what you, Jeremy, and Breakpoint, everybody's done with this, is you put a process in place and a plan in place that allows everyone that's selling this to be able to walk the talk, because we can execute on those things that we're out there talking about. And so if you are encountering the rare occasion where people are talking about some of the things that are addressed here, likely they've never executed on them. And that's the difference between talking and walking.
Awesome. Thank you, Seth. And to everybody on the phone, if you've got questions for us, reach out. We are all happy to help to go in and have the conversations and then be able to execute. Next up is Chris Hillier. Chris is a really brilliant guy when it comes to self-funding and stop loss in particular. Chris you've probably heard him speak at the producer meeting or elsewhere, and Chris's day-to-day is placing stop loss across the country. He does it day in and day out, and frankly, I don't think there's anybody better that we could have on the call to talk about stop loss as a part of self-funding. Chris, thanks for joining us.
Absolutely. I'm really excited to be here. And thank you, Brad. Thank you, Jeremy. For me, it's always a pleasure to hear Seth speak. And here's just maybe an introductory comment that I would make. If you can go out and even in 10 or 15 minutes, deliver the message that Seth just delivered, you're gonna win BORs all day long. Because as it's already been mentioned, there are not brokers or consultants or advisors out there that are having these types of conversations, at least not on the level that they need to be. And so we have a real opportunity here. I'm excited about the future. I'm excited about PinPoint Health Plans. I'm excited about what we can accomplish together. And I truly believe that if we can have more meaningful conversations with our clients, that we're not only doing right by them, but if we can have those meaningful conversations with prospects, that's really the key to earning new client relationships and growing. And so I'm just thrilled to be a part of this episode number 2 today, and for the efforts that are going into self-funding education and this particular product. If we jump into the first slide that I'd love to just speak to for a minute. If you have not seen this yet, you may be absolutely shocked to understand or to learn that over 75% of employees that participate on employer-sponsored health plans are actually part of a self-funded program of some type. So this is not something that's new. This is not something that's even revolutionary. This is something that's been going on for some time, and there's an absolute trend that's happening in this direction towards self-funding. I think one of the things that's happened is, as an industry and from a product standpoint, we've been able to bring sophisticated solutions down market extensively. PinPoint Plans is a perfect example of this. We can take this solution out to employer groups that have as few as 20 employees participating on their health plan. So brokers across the country, employer groups across the country, they're picking up on this, and they're understanding that there's more that they can do to manage the costs of their program. I've always been really enthusiastic about providing awareness and education around self-funding. What I love about our current situation is we can provide this type of awareness and education to one another as part of the Acrisure family, where we're all on the same team, we're all working together to accomplish the same goal, and our goals and our objectives are aligned. And so this is something that I think is important. The unfortunate reality is that employer groups out there are in the healthcare business, whether they like it or not. They may be in the restaurant business and they may be in the construction business, but we have to help our clients and employer groups out there understand that they're also in the healthcare business. And this is a significant piece of their business program and strategy that's ultimately going to lead towards success that they have as an organization. I will also mention, last point is, as we look at this movement towards self-funding on this slide, that I think that that employer groups are becoming aware of the terminology, but as you know, and as Seth really stated well, there are brokers that are doing this to different degrees of excellence with different qualifications and different credibility. And there's brokers out there that are doing this well, and there's brokers out there that are not doing this very well. And I think one of the things that I really love about PinPoint plans is that all of the cost management strategies and the ways to do this well are built into the program, so that again, we can make this pretty turnkey, pretty easy to implement, and pretty easy to present and to sell out there in the marketplace. So I'm going to be speaking a little bit about stop loss, and we have a lot of experience with stop loss. As an agency, we do a lot of stop loss placement ourselves. We do stop loss placement for brokers and even TPAs across the country. I have experience managing an MGU of our own that we no longer manage, but have been specifically in the stop loss underwriting arena as well. And this is going to be pretty high level. Again, for anybody who wants more detailed information, for anybody that would like help better understanding some of the real nuances of stop loss policies and treaties, of course, more than happy to connect and to chat through things. But at a high level, there's two types of stop loss policies: a specific stop loss policy and an aggregate stop loss policy. Both of these policies have a place in terms of protecting a plan, protecting an organization with their self-funded program. Obviously, specific stop loss coverage, which sets an individual specific deductible per plan participant, is there to protect an organization against a catastrophic claim that might be incurred by any one individual on the plan. Brad, if you don't mind jumping to the next slide, this provides an illustration here on the next slide of kind of what this specific stop loss coverage might look like. Just as an example, an employer could purchase a $50,000 specific deductible. They're self-funding their claims up to $50,000. If they are successful in properly managing those claims, there's a lot of savings to be had. But the liability for those unpredictable, sometimes unavoidable large claims is going to be taken by a stop loss carrier. And you know, if you're a 100 life group and you've got a $50,000 specific deductible in place, you know, a $75,000 claim or a $100,000 claim is one thing. But as all of us, I think, are aware of, there can sometimes be some pretty hairy and pretty scary claims out there. You know, you think about a $500,000 claim or $1 million claim or, you know, something to that extent. What we want to do is we want to take advantages of all the benefits, all the flexibility, all the control that we have in a self-funded program, but not take on that exposure, that liability for the really catastrophic claims. We'll continue to insure those. And so, again, you can get into the nuances of treaty contract terms and, you know, lasers or aggregating specific deductibles, and the list goes on. But at its core, the specific stop loss policy is going to protect the plan from that unexpected catastrophic claim that might take place. The other type of stop loss policy that we're going to have in place is an aggregate stop loss policy. And, you know, an unrealistic example, of course, of a scenario that could play out would be, we've got a $50,000 specific deductible in place, and every plan participant in the program incurs $49,000 of claims. Obviously, in that scenario, our specific stop loss policy hasn't done us any good, and yet we still have a pretty major problem on our hands. That's where the aggregate stop loss coverage comes into play and provides protection to the program. Essentially, there's a claim corridor that's put in place with a cap. a stop loss threshold referred to as an attachment point that represents the maximum liability or the most the plan is responsible on all of those claims that they're self-funding below the specific stop loss deductible. And so in these types of programs, we actually know what our maximum liability, what our worst case scenario would be. That's something that we can compare, for example, to a fully insured premium or a level funded premium, or the list goes on. We know what we're funding towards, we know what we're budgeting for, and we know where our opportunity is. And one of the things that's interesting, Brad, if you want to go to the next slide real quick, one of the things that's interesting is that in a traditional fully insured program, if you have a large claim, let's just call it, for instance, a $500,000 claim. That $500,000 claim counts against the plan and the loss ratio of the plan significantly, right? I mean, day one, you have a claim like that, and you're already running a loss ratio well in excess of 100%, and a loss ratio of 50% if you were to annualize the premiums that are coming in over the course of that 12-month period of time. We actually have a lot more ability to manage and sustain the cost of these programs, because that $500,000 claim on a self-funded program, only in the example I gave, $50,000 might actually hit our claim corridor or our aggregate loss ratio. And if it's a one and done claim, kind of a one-time thing, right? We're not going to be in a terrible position when it comes to our fixed costs in the program and the process that we go through at renewal time. But we haven't incurred a significant aggregate loss ratio as a result of just that one claim. This illustration right here, I think, highlights pretty well on the right-hand side what these self-funded programs ultimately look like from a cost standpoint. You've got your fixed costs of the program. Your fixed costs are made up by your administration fees, your network access fees or RBP fees. You've got your stop loss premiums. And then you've got that claim corridor that's set by the stop loss carrier, rec point, for example, and we know exactly what our maximum exposure is. One of the things, again, if you're not as familiar with self-funding and aggregate stop loss coverage, that I would just mention is that your attachment point is generally set at 120 or 125% of expected claims. And so there's a 25% corridor already built in where, you know, if our maximum liability or worst case scenario comes in somewhat comparable to a fully insured premium equivalent, we can plan without doing, you know, much of anything else on a 20 or 25% savings there. But if we're then effective in implementing proper cost management techniques and tools and strategies, the savings opportunity can be even more significant. On the next slide, and I'll tell a quick story along with this slide here, but I recently ran into an employer group who had about 200 employees enrolled in their program, maybe 250. And they were on a fully insured plan, and they were actually excited about the fact that they might expect a favorable renewal because their loss ratio with the carrier was only running about 50%. And I asked a few questions, and I tried not to be too obvious, but ultimately what I wanted to get at was whether or not they felt like maybe a no increase or even a 1 or a 2% increase was really a fair renewal and a good deal when they were running a 50% loss ratio with their carrier. And so ultimately what this slide is looking to illustrate is the fact that we can build in the stop loss protections. We can even build in monthly cash flow protection with specific advancement and aggregate accommodation and some of those types of things, where we know what our exposure is, not just in a given year, but perhaps even in a given month. And where and when we're able to do better than that, that delta, that difference is ultimately savings to the bottom line of the plan or the bottom line of that organization. And one of the points that Jeremy made at the start of this presentation, it was point number 4 of things to remember, was that self-funding does not have to be risky and it does not have to be scary. And ultimately, stop loss is one of the key components of the program that makes it not risky and not scary to go this route, and to, again, take advantage of all the benefits and all the flexibility and all the value that the program has to offer without making it risky or creating a scenario where one claim or even overall high claims utilization is going to blow up the plan or create an issue for the company or the organization. The reality is that, and Seth mentioned this, there's really no incentive for those traditional carriers to lower healthcare costs. If an employer wants to lower healthcare costs, they're going to have to do that in large part on their own and with our help. You take, for example, the medical loss ratio provisions of the ACA and look at the incentives again. There's no incentive there. If a health insurance carrier wants to increase their profitability and wants to increase their earnings, the only way they can do that is by increasing premiums. And the only way they can increase premiums with those MLR rules that are in place is to actually have the cost of healthcare go up. So I'm excited about this opportunity and this solution because it truly gives us a path forward in terms of being able to achieve these outcomes for each and every one of our clients and to grow our business. Just a few final points as you think about PinPoint plans and self-funding in general. Better economics and cost savings. These are more cost-effective programs. They're modeled that way. A lot of the fat that's built into traditional fully insured programs gets stripped out. That ability to manage the cost is now made available to us. Data and transparency, which Seth spoke to, is key to making smart decisions within any program. Think about how much money your clients spend on their self-funded program and how little data or information they might have currently to make those very significant and very expensive decisions. Flexibility and control, absolutely am in love with the program that's been put together here in terms of the unbundled approach and the controls that have been put in place for us and for our clients. And then finally, stability and sustainability. I know it doesn't happen every day. You all are in this business with us. But the reality is if you're a large group fully insuring your program, you're in an underwriting environment, whether you recognize it now or not. And the health status of your population, your claims experience, the expectation for ongoing claims are all going to play into the renewal. So to put a more cost-effective model with better economics in place, and then actually have the transparency and the data and the ability to control the decisions made within the program, ultimately are going to provide sustainability for our clients, which in good times and challenging times, I think is something that's needed and something that that we can deliver on. And so I guess just in closing, and as it relates to stop loss and the way BreckPoint, for example, underwrites stop loss, the strategic plans that are put in place, what we're doing with PBM, what we're doing with administration, what we're doing with network and reference-based pricing, what we're doing with direct contracting, right, and care management, and the list goes on. Those types of things have a place and have a role in the underwriting of stop loss coverage. And so ultimately, as we look at the economics and we look at those worst case scenarios or maximum liability numbers that every client's going to want to know and be interested in learning more about, we can not only drive claims down, but we can drive those stop loss numbers down as well through these strategies. So again, happy to answer questions and happy to connect with anyone who needs to or wants to learn a little bit more about stop loss underwriting and stop loss contracts. But otherwise, thank you, Jeremy, for inviting me on. It's been a pleasure to be here with everybody.
Chris, that was awesome. Thank you for taking a few minutes and walking us through that. So with self-funding and stop loss strategies laid out, now what does PinPoint plans do about it? So if we go to the next slide, back to the graphic that Seth walked us through, we have a unique opportunity in a self-funded situation to go right to the heart of this, better benefits at a lower cost. And the way that we do this is, if you go to the next, thank you, is we focus laser-like on the claims funding portion of the equation. So if you were to think about premiums and divide them into three buckets, insurance companies are going to place money in claims funding, they're going to set aside money for expenses, and then they're going to bring the profit bucket as much as they possibly can. Claims funding, as you saw in Chris's slides, are the vast majority of where the premium dollars go. So if you think about it, if we can shrink the cost of claims to Seth's point by reducing the number of claims or the cost of claims or both, we can make a significant impact in the cost or the price of health care to our employer groups. So how do we do that at PinPoint? There's if we'll go to the next slide, there's 5 cost containment solutions that we utilize in reducing claims cost. And we're going to spend an entire webinar getting into the nitty-gritty on each of these, how they work. There's a couple of high points that I want to touch. Not all areas of the country are the same. We may be able to get away with a very effective and good reference-based pricing negotiation in one area of the country. In another, we may need to go and do direct purchasing where we have direct contracting with hospital systems. In some parts of the country, we may have access to bundled payments through, for example, a surgical center that's all in, and you can get a knee replacement surgery at 25% of the cost of what you'd get it at the hospital. Better care for a better price. The beauty of PinPoint is its flexibility to provide a good solution for your client, no matter where you're at in the country. And then there's the prescription cost containment component of this, and the next webinar is going to be led by Sarah Klein and our partners at 44 North in talking through that in some detail. So what is PinPoint? What are we seeing at PinPoint? This top bar, PEPY, so per employee per year cost. When we get a quote in, we're seeing that their current price is averaging about $8,000 per employee per year. Renewals are going up, as most do, and we're seeing about $9,200 in per employee cost per year. The savings that we're quoting through the PinPoint program, again, by reducing the cost of claims, is at their max cost, what Chris touched on, their maximum exposure, $7,000 per employee per year. That's a reduction in most cases over their current of about 11% here below, if you look at this, or 23% in their renewal. Those are significant numbers to be able to take into your clients and demonstrate a savings, and then we can intelligently talk through with them or with you how those savings are achieved. Because often if you go in with something like this and they haven't seen savings in years, they're going to ask you how in the world that they're going to do this. And we'll be able to talk through the whys and the hows and the whats, explain it all, and we're here to help you do that. Next slide, Brad, if you don't mind. So I think we've all hit on a common theme here. There's really 2 things that I think we ought to be taking away. Is one, this is a very cool and unique prospecting opportunity for each of us to go out to clients and have a conversation that they haven't heard and win BORs. And number 2, it can be a great defense mechanism against other brokers or advisors who are going to come in and have this conversation in one form or another at some point. Whether it's the captives that are out there, you know, if you've seen Pareto and Roundstone, somebody's going to come in with that, or another reference-based pricing program, or whatever it may be, have the conversation first. So I think we want to open this up to questions, and let me just say this: please ask whatever question may come to mind. There's no stupid question. We are here to help. If you're an expert in this, great, ask a high-level question. If you've never done self-funding before, ask a basic question. We want to help. Brad, do you see any questions that we ought to address?
Yeah, thanks, Jeremy, and thanks again to Chris and Seth both for your input and voices today. It was fantastic. We're doing great with questions. So, and what I mean by that is there aren't a lot. So, to Jeremy's point, please feel free to fire away. Just to reiterate, there were a few questions on kind of how the PinPoint reference-based pricing approach is maybe different than what other advisors in the marketplace have maybe come across already, and some of the preconceived notions around that term. So, Jeremy, I know you mentioned we've got a dedicated episode coming up. Can you maybe just speak to a high level on what to expect in that next episode, and how this reference-based pricing approach is maybe a little different than what others may have come across in the marketplace to this point?
Yeah, I'm happy to. So we're a living, breathing example of this. We went through a reference-based pricing program ourselves with our employees, and it was brutal. It was difficult. We lost doctors. We lost access to care. We had balanced bills. All of the things that you probably heard of or experienced yourself in many of the reference-based pricing programs or plans that have been executed. This is not that. The reason it's different is a couple of things. One, we have flexibility to really negotiate with providers on their terms, right? If you come in and demand a certain price, imagine what you're going to get. But if you come in and negotiate truly and asking them where they want to come to the table, we want to end up with a great working relationship. And the TPA that we've partnered with does it better than anybody I've ever seen. So 99.6% of the time, we receive a negotiated point where we're below 200% of Medicare, and we're averaging 163%. So if you've heard it doesn't work here, it doesn't work with this, doesn't work with that, remember 99.6% of the time, PinPoint plans negotiates in full with the provider.
Awesome. We've got a few more questions coming in, and again, we'll have a dedicated episode all on how reference-based pricing works under the PinPoint arrangement. So encourage all of you to stay tuned for that. A couple more quick questions, and then we'll move on and take the rest of these offline. But could you just speak, Jeremy, or Seth, Chris, feel free. You know, what's the ideal candidate in terms of employer group for a program like this?
I'll kick this one off, and then Seth and Chris, if you want to jump in. From our standpoint on the stop-loss side, we want to bring a sophisticated solution down market to 20 or more employees. They don't really have to be a large group to take advantage of PinPoint plans.
Yeah, I'll add to that. This is Seth, and just say a couple things. I think that there are a couple of benchmarks that you can look at as you're just kind of quick firing off what I would say would be good opportunities. Anybody that's over $7,000 PEPY, it's per employee per year, it's worth having a conversation. And they're certainly not saying that people below that aren't worth having that conversation either, but it's just, then you're getting into some of the metrics of male to female ratio and age and geographic location and stuff like that. So I think that's part of it, kind of, if you want to set yourself a threshold of looking at. Anything over 10,000 PEPY is a slam dunk, you know, barring that they've got, 50 employees and all of them are cancer patients. But from that perspective, I think that is a good benchmark to have. Here's the reality of this, though. And I think there's two things you need to look at from this standpoint. One is there are certain employers that this will be a great fit for, but every employer is a great opportunity to have a conversation about this with. And if you're not, somebody else will. And so get ahead of it and have this conversation. And you can even say, hey, we have an exclusive product that only our organization has access to. We built it. We've managed it. We've worked within it to create it. And I want to see if you're a fit. Now, if you're not, but you like some of the things you're hearing, likely we can find a solution for you. But we still want to have a conversation with you about this. I certainly wouldn't not have the conversation about this with anybody.
I might just chime in with a couple quick thoughts too. I think it also has to do a lot with the mindset of the employer. I mean, we've all come across employer groups before, whether or not their demographics are right, their company size is right, their healthcare costs are right. we've come across those groups where they're just closed-minded. I mean, regardless of what you say and how well you say it, you are not gonna convince them to look beyond their, their current carrier. And so, those organizations that are really open-minded to kind of not increasing their administrative burden, but considering innovative and creative ways to go about things, I think is key. The other thing that I would just say in terms of who might be a good fit is that every once in a while I will come across that unicorn HR representative who gets it, who understands and who is willing to further the conversation. But I will also tell you that oftentimes these conversations are better had with the C-suite, with CEOs, with business owners, with CFOs, because if we're able to deliver on what we're talking about here, that's really meaningful for somebody who understands finance. And then we bring in the HR folks who are critical to the success of these programs, communication, education, implementation. And by the way, if you do this right, and I know there's been a couple questions about this, but if you do this right, I feel like that this enhances the quality of the program from an employee perspective. I mean, you're able to reinvest in the program in ways that you otherwise just can't do. And the employees actually come away the real winners when it's executed properly.
Awesome. Thanks, guys. So in the few minutes we have left, we do have some other questions. They're a little more nuanced. We have some state-specific questions, a couple stop-loss related questions, this cash flow question. So just know, all of you, I think in the interest of time and getting everybody on with their day, we're going to move forward and just cover the last few slides here. But we do have all your questions logged, and we know who submitted those. So we will be sure to follow up with all of you offline and get all of these loops closed. So if that's all right with you, Jeremy, I will go ahead and pass it back to you and let you cover the next steps.
Yeah, that's great. We'll definitely follow up with everybody. So where do we go from here? The next webinar is a repeat of this particular topic with Seth, Chris, and I talking about self-funding and PinPoint plans. This is going to be an opportunity for you to co-host clients or prospects. It's going to be on August 18th at 3 p.m. Eastern, 2 weeks from now. So tomorrow, or in the next day or two, you're going to get an email with an opportunity to register and co-host this next webinar. We certainly hope that you'll join and bring prospects to the table. If you can get somebody there, I imagine they're going to really buy into this and want to have further conversations with you, and we'll help you along the way.
And Jeremy, this is Brad, if I can just add one comment to that. So co-hosting sounds, I think, maybe a little and more intimidating or time committal than we intended to. So co-hosting is literally just a co-marketing opportunity. All the presenters you heard today will be the presenters on that call, but we want to give you a kind of a front and center spotlight as a co-host, quote unquote, to bring this and drive your clients and prospects to attend this. So no one's, don't be looking for any panelist invitations. That's not necessary on your part, unless certainly you'd like to. If so, reach out, but just wanted to clarify that point.
Yeah, thanks, Brad. And then second is the upcoming series. So in September, it's going to be prescription strategies. We've got just an awesome opportunity to learn about how to solve the rising cost of prescriptions. In October, we're going to do a deep dive into reference-based pricing and how we do it with PinPoint. And then November will be about alternative reimbursement strategies. So each of these, as you can see, there'll be an advisor webinar and then an opportunity to bring an employer to see the same webinar. You get to preview it first, ask your questions, and then bring folks to it. We are happy to provide quotes and impact analysis for your clients. So if you've got somebody in mind that you want to take a look at PinPoint plans and what that might mean, we partnered with Next Impact. They're providing this impact analysis and helping along those lines. And then in the next slide, this is really all we need to put a quote through. And I just want to throw this out there. If you want to go through the motions, but you're not quite sure if you want to present this to your employer, please feel free to send them in. We'll run up a quote for you, and then we're happy to talk through it with you so you understand it, with no real true commitment to take it to your employer. But, you know, to Seth and Chris's point, it's a great way to engage and have a different conversation. So all in all, a couple of things that we hope you heard today. One, everybody's self-funded in one form or another, right? We're paying now, we're paying later. And two, please have the conversations with your clients. It's important that you do. Somebody else will if you won't. And three, from an employer's perspective, taking on self-funding, having the transparency, the control, and the strategies that can generate liquidity or cash flow it's a critical time for many businesses. And this could be the difference between, you know, letting jobs go or other things that they're in a difficult place. Bringing a solution to them is really important right now. And last but not least, we're here to help. It doesn't have to be scary or difficult. We'll help you every bit along the way. Everybody, thanks for attending. Brad, anything you want to add before we end?
No, I think you guys did a fantastic job. Thanks again to Chris, Seth, Jeremy, thanks to you and your team. This is a team effort in the truest sense of the word, and thanks to all of you, our agency partners, for listening, hearing this out, and most importantly, having this conversation in the marketplace. You know, we can't drive this forward without you. So with that, I will go ahead and end the call today and look forward to catching up with all of you on episode 2 with the employer audience, and then episodes 3, 4, and 5. So have a great rest of your day. Thanks again, everybody.